Dignitaries, partners, colleagues, and friends, a very good morning to you all. Thank you for inviting me to address you today. I'm sorry I'm not able to be there in person, but I appreciate being able to share my thoughts with you. In speaking about the voices of people with lived experiences, I would like to start by telling you a personal anecdote. Before I had the privilege of being Regional Director of WHO's Southeast Asia region, I worked in public policy relating to mental health and neurodevelopmental disorders through a foundation I had started some years earlier. In 2011, I launched the Global Autism Public Health Initiative in Bangladesh, in partnership with Autism Speaks and the WHO, and also facilitated formation of the Parents Forum for the Differently Abled. Both of these platforms were launched with a vision to encourage social participation and promote the inclusion of self-advocates and their caregivers within policy design and program development. When we partnered with parents and professionals to work on Bangladesh's National Strategic Plan for Neurodevelopmental Disorders and the National Mental Health Strategic Plan, we first made sure that we heard from people with lived experiences. When we worked together, this was absolutely invaluable because after their input, we realized that we had to engage a broader group of government representatives and official stakeholders than we initially thought. For example, after input from parents, we understood that many of the problems they were facing could not be solved by the national government and would instead need changes at a local government level. Thus, we brought to the table cities and municipalities and other local government entities to enable changes at the level of the last mile infrastructure and service delivery. Had we not done so, we would have crafted a policy which perhaps would have been impressive on paper, but in its implementation would not have had led to the results that were needed and deserved by the targeted beneficiaries. This experience showed me how vital it is to include the voices of people with lived experience in every planning process. People with lived experience can be powerful advocates for people-centered, recovery-oriented, human rights-based mental health care, and for policy and legislation that protects their rights. As for any other segment of the population with mental health conditions, people have the right to life, a right to non-discrimination, a right to health, a right to privacy, a right to legal capacity, and a right to inclusion. They also have a right to participate fully in society. The significance of mental health and its impact on individuals' overall well-being and quality of life is undisputed. 1 in 7 people living in our Southeast Asia region suffer from a mental health issue. Worldwide, those with mental health disorders remain stigmatized and misunderstood. Stigma and discrimination, combined with a lack of adequate services for individuals with mental health disorders, significantly impact individual, family, and community well-being. It impedes access services and gives rise to isolation and shame, only deepening the existing burden of the conditions that we already have very limited understanding of. There are many common challenges faced by those with mental health conditions that we need to address immediately. These include exclusion, marginalization and discrimination, involuntary admissions, denial of employment opportunities, physical abuse and violence, limited access to effective mental health and general health services, sexual abuse and violence, arbitrary detention, denial of rights to marry and have children, and financial exploitation. These factors contribute to a cycle of silence, where individuals are hesitant to openly discuss the experience or seek help. Misconceptions surrounding mental health also perpetuate the notion that individuals with mental disorders are weak, dangerous, or unable to contribute meaningfully to society. This hinders early intervention and treatment, allowing mental health conditions to deteriorate, leading to worsened symptoms, diminished quality of life, and an increased risk of self-harm or suicide. Further compounding the issue is a lack of accessible and quality services in many parts of the world, including in our region. In addition to health, these services include education, provision of employment opportunities, access to finances, and social protection. Limited resources, inadequate funding, and a dearth of trained professionals pose substantial barriers to individuals seeking help. To create a mental health system that truly serves the needs of its diverse population, the active engagement of those with lived experience is crucial. Their lived experiences provide invaluable insights, promote inclusivity, reduce stigma, enhance accountability, and align with recovery-oriented principles. Importantly, recovery-oriented care is not only about treatment of symptoms, but also about empowering people to have control of their own lives. It involves supporting people to find hope, develop self-esteem and resilience, build healthy relationships, regain independence, and to live a life that has meaning for them, whether that be through school, vocational training, work, friendships, or community engagement. It is also important to create safe spaces for open dialogue. Stories of recovery and resilience shared by individuals who have successfully managed their mental health conditions can help break down stigma and inspire others to seek help. Peer support networks and community organizations can play a vital role in fostering understanding and acceptance. Addressing issues facing those with mental health conditions requires a multifaceted approach. That includes active involvement of those with lived experience. It requires comprehensive awareness building to challenge stereotypes and misconceptions about mental health, and also the development and expansion of mental health services that are user-oriented, accessible, affordable, and culturally sensitive. I thank you for inviting me to speak to you today, and more than that, I thank you for your consideration of the voices of those with lived experience. Thank you.